Welcome to Western Wisconsin Journal. My name is Meg Heaton. I'm a retired reporter with the Hudson Star-Observer. We've lived in Hudson for over 30 years now. My guest today is also a longtime Hudson resident, Hudson physician Dr. Paul McGinnis. He's spent his entire medical career here in Hudson and continues to be very active in the community, including being a member of the Hudson Area COVID Task Force. Welcome, Dr. McGinnis.
Thanks, Meg.
We last spoke back at the end of May, and I think we were hopeful that things might be a little bit more back to normal than they are right now. And I know that you have a good handle on the numbers and what's been going on. So could you kind of give us a picture of where we are right now with the numbers and kind of what they mean?
Well, also like you, I've retired from Hudson Physicians, but still value my time in the community. So talking about the numbers, so you and I were talking before we went live here that the last time we talked was the end of May, and back then I looked back and we were at about 80 cases in St. Croix County. Well, as of yesterday, we were at 558 cases. So that's a pretty dramatic increase. June was actually not bad. July, that didn't go well. And then the governor's mask mandate came down at the end of July, and we're still kind of waiting to see if there's results from that. And I've got my fingers crossed, but I don't think we've had quite enough time for really to know if that's making a big difference. And of course, now we're also looking down the approach of school opening. And I think there's lots of folks who are concerned, medical experts who are concerned about what impact that's going to have. I think we all hope it will have little or no impact at all, and our kids will be face-to-face. That's absolutely everyone's goal. But there's also some real concern about increasing spread in that group of young people and what that impact may have on our ability to do face-to-face education and also on the teachers and the staff that may be exposed.
Right. And that group of, for a long time there, it seemed that young people weren't as susceptible to the virus as my age group or whatever. But we're seeing those numbers tick up in that age group, in those 10 to 29 group, right?
Yeah. And so I think there's three ways to think about this. One is, do they get it? The second is, do they get really sick from it, or do they have fairly mild or even asymptomatic cases? And then the third question is, do they give it? Do they spread it around? I think that the information suggests that they tend not to get very sick, and I think that's been pretty consistent throughout this whole thing. Not that it can't occur, but it's pretty uncommon in among kids, and I'm talking about that 0 to 19 group. Okay, so we're going to focus on that school age group for the moment. Do they get it? I think that back in June and even part of July, there was some really thinking maybe they don't get it very often. There's been a swing in the last month or so, and the numbers of young people, both nationally and in Wisconsin and locally, school-age young people that have contracted this and tested positive is actually starting to jump up, and that's a bit of a concern. The other piece is, do they transmit it? There was a study in early July that said there's about, in the younger kids, the elementary age kids, 10 and under, the chance of spreading the virus seems to be about half of what the adults are. However, the older kids seem to have the same rate of spread as an adult. But there's been a couple of other things that have started to surface to suggest maybe that's not quite what the case is, and that the risk of transmission even from the younger kids is higher. And I don't think we know yet. So that's what's got everybody on pins and needles and just a little concerned about that.
July was kind of bad, and that was timed kind of with the Supreme Court saying we could open up, or we should open up. Do you think it has to do with that? I mean, Hudson kind of looked like the old days on some of those weekends.
I've looked at that. I'm not convinced there's a direct linear relationship to that Supreme Court decision back in mid-May, because then I would have expected a big rise by the middle of June, which didn't happen. Our rise really occurred in July, which suggests it was the behavior and the activity of folks in the county the end of June and early July that really set this off. I think what happened was people let their guard down. I think people assumed that this was just going away. They assumed that it was pretty well under control. They began to gather in larger numbers. They began to be less vigilant about all those things that we talk about, which is the distancing and the hand washing, and yes, even the mask wearing. And I think that's probably where our problem came from. I think if you look at the experience in other states like Arizona or Florida, Texas, California, some of those things, as they reopened too fast and things went just too quickly, they had similar problems. Actually, they had much worse problems than we've had. So we've dodged some of that bullet. But that I think it really comes down to people letting their guard down.
Well, and I think, it wasn't just that they could open up bars, and a lot of the people that were downtown Hudson were from Minnesota too.
Exactly. So where did they get registered as being ill? In Minnesota?
Yeah, but I did notice in those days and weeks after the Supreme Court decision that when you went into stores, you didn't see as many masks. You saw people, greeting, standing very close together. I saw young people at batting practice, at the parks and that kind of stuff. So I think you're right. I think it was just kind of a general, maybe a too soon sigh of relief that we can get back to normal.
Yeah, I think everyone was hoping for normal. Everyone, myself and the public health folks and everyone else concerned, was really hoping for normal. And I think, unfortunately, the virus proved us incorrect on that one.
Right. Where are we at in terms of testing?
Yeah, testing, that also went through a big bump in the road, especially around the mid to end of July, where there were so many cases nationally that the labs just couldn't keep up. And so that led to some significant delays of up to 2 weeks, which at that point really makes testing not terribly valuable. The good news is what I've seen from local providers and what I'm hearing is that time lag has come down dramatically and is down in the 1 to 2 to 3 day range. So that is much more usable. The goal is to have tests back within 24 hours, because then you can really help people contact trace, isolate, do those things you need to box this virus in and get it out of the community so that we're not spreading it to other folks as people move about, unknowing that they have this illness.
Right. So, I mean, where if someone are we still just testing if you have symptoms or if you've been exposed, or can anyone get a test?
I think at this point it's still primarily if you have symptoms or if you've been exposed. We do know that there are some places requiring a test before you go back to work or for certain activities. But I don't know that right now is what the official way to do this is. I think there's a real desire to expand that testing. So occasionally they will go ahead and test a large group just to make sure they know what's going on within that group. But at this point, it really is symptoms. There was a question that came up, and I'll just go ahead and answer it because you may be about to ask it. I've heard from a number of parents is, okay, if I have one person in my household who tests positive, we're all quarantined. I have 3 other kids who develop symptoms, or I and another child develop symptoms. Should we go in and get tested or not? I mean, we're still going to be quarantined for the same period of time. And I think the answer is probably yes. You should get tested because we need to know for sure that it's the virus. The second thing is there are other things that are going to be coming down the road over the next few months that can look a lot like COVID, but are different. And some of those are very treatable. So I'm thinking things like whooping cough, RSV, which is a respiratory cough illness. I'm thinking of influenza, which unfortunately is also waiting in the wings here. And so there is some value to being tested to make sure that indeed, A, it's COVID, and B, so you know that where it is in your household. Because we also have people who have what look like COVID symptoms, may have been exposed to somebody with COVID, but test negative. Sometimes that's a false negative, but sometimes they actually don't have it. They just picked up something else.
And we know that there have been some children who have tested positive that were at the summer school one of the school summer school programs and stuff. So basically, if anybody gets symptoms, they should be tested, or if they've been directly exposed.
Yeah, I recommend that they talk to their healthcare provider and get their recommendations, because those are the folks that are really at the front line. In general, I would say yes, but for an individual in an individual circumstance, then I would have them talk with the healthcare provider.
And because we hear also that there are sites, you could drive over to Washington County and they had a weekend site. And I think people are confused as to who they should talk to. But basically what you're saying is talk to your doctor first.
Right. The weekend sites are primarily being used if there are larger outbreaks and a community really needs to get a handle on what's going on, or if there's felt to be a significant amount of virus in the community, such that the local healthcare providers just can't handle the volume.
You're also a member of the Health and Human Services group that is addressing COVID in the St. Croix County. Can you talk a little bit about what's going on there and what people should know or you think they would be interested in?
Yes, the Health and Human Services Board. So it's the board that oversees the Health and Human Services Division of St. Croix County. And that includes lots of areas, but public health is one of them. And obviously public health has been front and center of this whole pandemic. I was appointed to the board as a physician member and asked to be part of that. So I'm not directly elected, but do have a voice and vote at that board. And so I think the thing that caught everybody's attention last night, other than the presentation for public health, kind of updating everyone on the current status. And just a point on that one is they were pretty clear about some of the shift into the younger population. And that's something that they're seeing. And then the second thing we work a lot on is, do we have the adequate staffing and do they have adequate resources to respond? It's a pretty small department for the number of citizens in our county. And so that's something that we have to continue to keep a very careful eye on to make sure that the resources are there to take care of our citizens and to manage this pandemic. And the county has stepped up to the plate on that.
In this, in terms of public health, have they identified certain areas of the county? I mean, do we know what the numbers are like in the Hudson area versus, like, say, Glenwood City? Or, I mean, this is a big county. Yeah. It covers a lot of ground.
So I did take a quick look at that. And if you go to the county website, click the red button under COVID. If you look further down, there's actually a dashboard. And you can click into the dashboard. In the dashboard, on the lower right side, there is usually a day-by-day case number chart. It's a whole bunch of little squiggly red lines.
Okay.
But if you look below that, there are 3 tabs, and one of those tabs actually will get you to the state census map, and you can see how many cases have occurred in each portion of the county based on the census tract data.
Oh, wow, good.
And next to that is a chart that shows you the cases by age, cumulative at this point in time. And the new epidemiologist that's been hired by the county is going to continue to work with public health and others to provide useful information in those pages for people to see and view and be informed. And so those are 3 tabs. They're kind of hidden down there. And so people look for those. That's all right there. In specific answer to your question, I think what I see from the information suggests this is pretty much distributed across the county. So there's not one area that's a particular hotspot. It's kind of all over. I did look at the numbers, and let me just quick see. Oh yeah, here we go. If I look at the Hudson, the census tracts that incorporate the city of Hudson and its immediate surrounding area, so I'm thinking like the town of Hudson, part of the town of Troy, we got about 169 of the cases so far have been in that specific area. So that's Hudson, North Hudson, town of Hudson. If I expand it out to St. Joe, expand a little further into the town of Hudson, expand a little further into the town of Troy, you add another 109 cases.
Of that 558 that we have countywide.
Yep.
Okay.
Yep.
And the fatalities that we've had are about 8 or 9, I believe, or something like that.
7 at the moment.
7 at the moment. And those have been primarily in an older population, right?
Right, yeah. So they have been in that population that's over the age of 70, as I understand it. Individual specific data. It's difficult for the county to release that because of privacy concerns and wanting to be very respectful to individuals for that. I think that while that number is small, if you look at that population and the instance of COVID positives in that population, there's been about 15% of our population of that age that has had positive cases. So of all the positive cases, 15% of them have been in that older population. 100% of the deaths have been in that population.
Yeah.
So it really is that younger population that protects the older population. Yeah. And so that's why this is so important, because it's not about what I do for me. It's about what I do for my neighbor, for my friend, for my elderly, for the veteran, those types of folks, for the teacher, for the school kid. And so that's one of the things I've heard a lot about people. Well, I'll just take care of myself. Well, unfortunately, what you do is what impacts me, and what I do is what impacts you.
Exactly.
And that's really an important piece of the puzzle.
Absolutely. You had mentioned, can we talk a little bit about the vaccine, where we're at with that? What's your perspective on that, where we're at?
Optimistic. So several of the vaccines are now in what's called 3rd stage trials. And this is where they administer the vaccine to about 30,000 people. They've selected areas where people are more likely to be exposed to COVID, so they can get a real good feeling for, does this make a difference or not? They've had the initial stage 1 and stage 2 trials that look at safety. So they think that the safety data looks pretty good. However, until you get into stage 3, you really don't have as good an answer as you would really like. And then, of course, there's also additional monitoring that goes on after the vaccine is released more broadly, because sometimes things show up late. They're usually pretty rare. The big stuff happens frequently and commonly, and so they haven't seen that yet, and that's great news. The other thing I think that's really optimistic is the fact that there are several of these vaccines that have shown good antibody response and good immunologic response, and that's optimistic. Now, we'll always have to take that and meet it to the real world and see if it actually bears out. I think the third point of optimism is that the government has set aside money to pay these companies as soon as they enter stage 3 trials, and the stage 1 and 2 results are reviewed and felt to be positive enough to enter into full-scale production. Typically what will happen with the vaccine is you do the stage 3 trials, then you go through an approval process, and then they begin to tool up production, and then the vaccine actually makes it out. And that's usually a couple-year process. In this case, some of those companies are already in full-scale vaccine production. And that's good news for the world in general, because they sell their vaccine all over the world, but also for the United States in particular, because the United States has been pretty aggressive about purchasing quantities of the vaccine. When will it be available? That's the really big question. And the answer is nobody knows for sure. Many people are hoping by the end of the year or hoping early into next year, but things happen and sometimes stuff gets slowed down or there's other issues that occur. So I would say at this point, next spring looks to be reasonable, but things can change.
And I do remember when we did the N1 or H1N1, whatever. I remember when we did those vaccines, like I remember being at the middle school and watching that happen. I mean, we had a pretty good protocol for that. So it went really smoothly when that went down.
And I think we're waiting to find out what the protocols are going to be for who gets this first. So one of the things people need to remember is the fact that when the vaccine is released, it's not going to be available for everybody all at once.
Right.
It's going to take months to get vaccine into enough individuals to really feel like we have an adequate protection in the population. Plus, there are a number of experts that are really concerned about people either deciding not to get the vaccine for a whole variety of reasons, some good, some not so good, in my opinion. And if there's a large enough part of the population that doesn't get it, we still have a problem. We still have a pandemic that can make its way through our communities. And
now that you mentioned earlier, we are looking kind of coming into the flu season, the regular old flu season, if you want to call it that now. What should people go ahead and get their flu shots? Will they be available the same way as they always are?
Yeah, they absolutely should get their flu shots. And this year would be a much higher priority for that, because the last thing you want is to get the flu, get sick, pick up COVID, and get a whole lot sicker.
Right.
You can have both at the same time, and that's a recipe for disaster. And so the flu vaccine is really critical this year. We know it works. We know that it is very safe. It's not perfect. None of the vaccine is. We know it's actually very effective, and it works well. So yeah, absolutely, get the flu vaccine. I meant to check with the clinics to see if their vaccine supplies are starting to come in. Usually it's the end of August when they do, so I would expect in the next few weeks we should start hearing more about that. But absolutely get the vaccine. Good
advice. We had talked a little bit earlier about school, and obviously that's a big unknown at this point in terms of it. But I know that Hudson is approaching a hybrid type of an approach, giving people some options. What's your thinking about sending kids to school in Hudson right now?
So let me correct one thing you said. Hudson is offering a couple of approaches to education.
Okay.
Hybrid is actually a specific term that means a certain type of education.
Oh, okay.
So hybrid is one of the options that they may need to engage in based on what they see in terms of the amount of virus in a school building or in the community in general. So if there's a lot of virus in the community, if there's a lot of positives in the building, then they're going to have to shift the educational model to provide protection and try and limit the spread. So I think they've come up with some reasonable tools. I think they built some of these off the work some of Minnesota had done. So there's some good, I think, reasonable science behind it. But I think that it always is going to lag a bit behind, because by the time you see case numbers really start to climb, if you make a change, it takes about 2 weeks for you to see the results of that change. So it takes time. It's not just an instant type of thing. And that's one of the challenges with this type of a pandemic. It is, you do something and it takes time for it to respond. Coming back to the original question you asked is, what should parents do? Now, that's an individual decision based on the parents. Some kids do great with distance learning. Other kids really need that in-person contact. Some parents have the ability and the technology and the resources and the time to be able to do in-home education. For other parents, that's simply not an option. They need 2 incomes, or they don't have the access to the technology, although the schools and other organizations are trying to provide that. And so that becomes an individual decision. And then we get into each family's assessment of risk and assessment of the individuals in the household and their risk. So if you have your 90-year-old grandmother living with you, you might make some different decisions than if there's nobody living in you and you have a pretty neat household bubble that you're pretty careful with. And so that becomes individual decisions. And so that's the hard part, is each family has to kind of walk through that and make the best decision for them and for their children in the situation. I think we as a community can support those families, support those kids, support the teachers, and support the staff by doing all the stuff that public health asks. Putting the mask on, keeping our distance, washing our hands. Don't go to big gatherings. Just don't have them. Don't go to them. That's where this thing is going to get loose, and that's what's going to cause our schools to have to shift to a different model. And nobody wants that. Everybody would prefer to have in-person education, but we have to do it in a way that's safe for all concerned, the kids, the teachers, the staff, and the community in general.
Right. And those things, those precautions that you mentioned, those are the things we know for sure in a world where we don't know a whole lot for sure, but those things we do know work. So
they do work. They do work. And if we do them consistently and everybody takes a part in it and everybody steps up to the plate, that's going to make a difference.
Based on what you just said, then what's your best prognosis going forward in terms of what it's going to look like? Say you and I meet again, let's see, that was the end of May. So we'll meet again in 3 months. Where do you think we'll be at?
I think that's a great question, and unfortunately, I don't have a good answer. There's just so many variables. We know this virus lays in wait, so even in a community that's doing a great job, if they let their guard down, this thing takes off. And that's been shown over and over again. It's being proven in Europe, in certain areas of China and things like that. And you have to kind of then tighten things back up, get it back under control, and then gradually and slowly open things back up so people can do more of the typical normal activities. And I think for us in St. Croix County, it really depends on how we do as a collective. So when I think about all these things we talked about, none of that is locked down. None of that is restricting much in the way of activities, with the exception of large groups and the distancing thing. But that's really what works. And if we don't do those things, then we are going to have more problems. If we do those things, that's the best way to keep it all under control and to allow us as many options with our lives as we all would like to see. I mean, I miss dining in. I miss getting together with people. That's really hard.
Well, and I think that there's so little in this that we can control but we can control those kinds of things. We're wearing the mask, washing our hands, keeping our distance. I just wish this would have been around when my mother-in-law was alive. I could social distance from her all week long. There are those people. There are those people. Anyway, is there anything else I haven't asked you about that you'd like to mention, Doctor?
I think there's one other really important thing, and that you didn't ask. There is something else we have under control that is really important in all this, and that's kindness. And that's really understanding that sometimes the person who's not wearing the mask isn't doing so because they're making a decision to not do that. They just simply can't for whatever reason. And I don't know them well enough, and I don't have the information to say, hey, you really should put that on, or I really get what you're going through. So I think there's a kindness there that's really important. I think the flip side is if you can wear the mask, then the kindness piece becomes really important to put it on. And also then it's just being kind in general. Everybody's under a lot of stress. I mean, parents have got to be stressed out through the roof right now. And teachers are. I certainly know that from the folks I've talked to. And so those little acts of kindness can make a huge difference in people's day. We know this has had a hard impact on people's mental health due to isolation, due to change, due to all those things. And again, that little bit of kindness makes a big difference for folks that are in those situations. And I think that that is the other thing we have under our control that may actually be as important, if not more important, than the other things we've talked about today.
Yeah. Yeah, it's time to brush off the golden rule. Treat others like you'd like to be treated.
Yeah.
I think probably.
And
Well, thank you very much. I'll look forward to us talking again in a couple more months with maybe sitting across from each other. That would be good.
That would be wonderful, wouldn't it? It's not going to happen until we get enough protection
All
within
right.
the community. So,
Okay. Thank you again, Dr. McGinnis.
okay. Bye-bye.